Hello, everyone. My name is Taylor Davis. I'm the Regional Managing Director here at Ameritas. Wanted to thank you for taking the time out of your busy schedule to join us and talk a little bit about dental and vision and why it's important to have in your product portfolio, specifically how Ameritas stands out from the crowd through our no waiting periods, large network, product simplicity, ease of enrollment, and much more. In this webinar, we're going to be going over, again, why dental and vision, specifically why Ameritas Dental and Vision. We'll be going over our new product that we launched in 2019, and then we launched additional states in 2020. And then we'll also be going over our network and ease of enrollment. So first off, why dental and vision? Why is dental and vision important to have in your product portfolio? We do a lot of research here at Ameritas on dental and vision, and especially for you, the agents, on how it can help with your overall business. The first thing with dental and vision is referrals. Dental and vision is a product that your client is going to use. It's not home insurance or car insurance that maybe they're hoping that they just don't use. When a client is purchasing dental and vision, it's a product that they're looking to use. And with our product, they can use it as soon as tomorrow. The more products that customer has, the better persistency they're going to have with you. So maybe you're in the Medicare space. Maybe you're doing life insurance. Either way you look at it, the more products that client has with you, the better persistency they're going to have. Be that one-stop shop for that client. Don't make them have to go to another agent to pick up dental and vision. Have dental and vision ready for them. It's adding value to your client's life day one. I'll show you an example here in just a little bit, how much money you can save them with a product like dental and vision. And really it adds to your reputation. They're going to be using their product. They're going to be talking to their friends, their family, their neighbors about, wow, I just saved X amount of dollars when purchasing through Mr. and Mrs. Agent for dental and vision. They can use that additional the additional funds that they didn't use for other sorts of life insurance, Medicare, home insurance, car insurance, vacation, whatever they're looking for, you can save them money. That's adding value to your client's life day one with our product because there's no waiting periods and next day effective dates. So why Ameritas? I know there's a lot of carriers out there to choose from when it comes to dental and vision. Here at Ameritas, I like to talk about our expertise. We have a lot of years in the senior dental space, the under 65 space, and when we launch new products, we focus on a lot of attributes to make the product as best as possible. So when we do roll out new products like we did last year with PrimeStar Protect, and then we rolled out about 10 more states a few months back with PrimeStar Protect, there's three things that we focus on when it comes to our product. Number one thing is product simplicity. We want to make sure that client understands the product. Whether they're turning 65 and they've been in the group dental space for a long time, we want our product to kind of mirror that group product as much as possible. Or if you're talking to someone that's maybe 30 years old or 25, who this might be their first dental and vision insurance, we want to make sure they can understand it too. So we want to make sure that product simplicity is there. Second thing is providing that economic value. And we provide that economic value by having no waiting periods. So they can go in tomorrow and get basic, major, preventative day one. So no waiting periods. That's adding value to your client's life day one. And also, we want to make sure that network is large. I'll go over the network here in just a little bit on how big the Ameritas network is. And really the last thing is ease of enrollment. As an agent, we don't want you to have to walk the client through a product and then have an enrollment process that stretches 20 minutes long. Our enrollment process is not a paper app. It's not even really an e-app. It's all electronic based off of a hyperlink that you receive once you're contracted with us, which I'll go over here shortly. Nationwide coverage. I'm happy to say that we are in all 50 states. This also helps you, the agent, not have to have multiple products. You can have Ameritas Dental and Vision and know that, hey, Ameritas is in all 50 states. I don't have to worry about having another product if I'm talking to a client in another state and I have to switch gears on the product I'm talking about. Here at Ameritas, we are in all 50 states. You will see some that are in gray, like Washington, Missouri, Pennsylvania, New York, New Hampshire, and Maryland. Those are just on our old product, PrimeStar Advantage Plus. Texas, Illinois, and Connecticut, just a little bit of state specifics there. And I'll go over quickly Illinois and Connecticut, how that state specifics change. Texas, for instance, really not a big change at all with regards to our PrimeStar Protect network. So PrimeStar Protect, again, happy to say that we launched this product. First launch was in September of 2019 with 34 states. And then this year, a few months ago, we launched 10 more states. So we're in 44 states with PrimeStar Protect. And again, we do a lot of research. We look and see how we're going to provide the most economic value possible for your client. And how we do this is with preventative, 100% day one. Again, no waiting periods on bite wing, cleanings, exams, fluoride, sealants. They can go in tomorrow. We'll pick it up 100% day one. Basic, 65% day one. Filling, simple extractions. You're talking to your client today. Tomorrow, they can go in 65% day one. Major, root canals, bridges, crowns, dentures. And yes, even implants, no waiting periods, 20% day one. Same thing as preventative and basic. They can go in tomorrow and get that work done, and we'll pay 20%. Ortho, 15% day one. Now let's jump into year two. So preventative, 100% day one, stays 100%. Basic, 65% day one, 80% after year one. So on anniversary, it jumps up to 80%. Major, 20% day one. So tomorrow they can go in and we'll cover 20%. On anniversary, on plan year, it'll jump up to 50%. Ortho, same thing. It'll jump up to 50% after year one. Plan year deductible, $50. That's a very low deductible, and it does not go towards preventative. Do not have to pay the deductible for preventative. Basic, major, and ortho is for the deductible. Benefit year maximum is $1,000 or $2,000. As I mentioned before, Illinois and Connecticut, I said super little state specifics. The maximum benefit in those two states are $1,200. So again, very, very small state specifics there. But again, this product is in 44 states, and we still do have our old product, PrimeStar Advantage Plus, which is in those 6 states that I mentioned before. And same thing with PrimeStar Advantage Plus, there's no waiting periods. The only really difference with PrimeStar Advantage Plus is basic is covered 50% day one, 50, and major is covered 15% day one. It's really the only difference with that product. Those 6 states that are on the PrimeStar Advantage Plus product just are, we're waiting to get approvals on. Along with product simplicity, we want member flexibility. So what comes with member flexibility is the option for your client to choose, do I want an Ameritas dental network product, or do I want to go with the Ameritas PrimeStar Protect product that they can go in network or out of network. So with regards to Ameritas Dental Network, we pay claims at negotiated rates, MAC, maximum allowable charge. We currently average about 34% on those negotiated rates, but we range from about 25 to 50% on negotiated rates. And again, that's not even talking about the co-insurance. So I'll go over an example here in just a little bit on how much money they can save by going in network. Now, if your client has been going to a dentist for a long time and for some rare occasion they're not in our network, then we pay claims at 80th UNC. What does that mean is we look at a specific zip code and we look at what 8 out of 10 dentists charge in that specific zip code. To give you an example, if a client were to go in tomorrow to an out-of-network dentist and they get crown work done, again, because crown work is a major, we have no waiting periods on it. They go into an out-of-network dentist. That dentist charged $1,300 for that crown work, but 80th UNC was $1,200. We base our 20% day one co-insurance off that 80th UNC, off that $1,200. FairHealthConsumer.org is just a great website the client or yourself can use to see what is the 80th UNC in my zip code for crown works, for for cleanings, for dentures, for really anything you want to look up, you can look at it at fairhealthconsumer.org. Great website to use. So why is network important? What value does the network bring? It's lower premiums. If you were to go to PrimeStar Protect Network, it's lower premiums than just PrimeStar Protect. It's contracted fees, a good negotiated rates. Again, we're anywhere from 25 to 50% savings on those negotiated rates, and we're averaging about 34%. There's no balance billing when it comes to network, and no claims forms. What I mean by that is they're all electronic. So all of our in-network dentists submit claims electronically. The client does not have to worry about anything. Ameritas Dental Network. We are committed to growth. Just in the last year, we've grown our access points by more than 70,000. Currently, we're about 557,000 access points. I think it's super important to talk about access points. You hear it a lot in the dental and vision space. Access points is the brick and mortar locations where a member can seek dental services. So inside of those access points, we have 127,000 unique providers. Now with our growth, I like to talk about our strategic growth. You know, like I said before, we're averaging about 34% savings and negotiated rates with those dentists in our network. We could easily be at, 800, 900,000 access points, but our negotiated rates would be lower because we'd be with more dentists. They wouldn't give, we want to team up with the best dentists that give us the best negotiated rates. And right now we're about 34%. Large network, anywhere you look in a specific zip code, we're going to be 1, 2, or 3 in that network space. Providing that economic value for your client, this is what I was talking about on saving the client X amount of dollars when it comes to dental and vision. So with regards to UNC rates, that is what 80th percentile. I think the zip code is in Minnesota. Again, fairhealthconsumer.org is where I got this $1,227. But again, if they were to go in tomorrow, they have no insurance, they're probably going to be paying around $1,300 for Crown. Now with our network rate, again, we're averaging about 34% on the negotiated rate. So without even getting into the product itself, the co-insurance at 20% day one, you're saving that client almost $500 by just being in network. Now you add that 809 times 20%, day one cost is $647. You're saving your client $580 day one. That's a big savings. Again, back to my the beginning of the webinar. Reputation, referrals. They're going to be talking to their neighbors, their friends about, wow, I just saved $580 by going with Mr. and Mrs. Agent, and now I can buy additional life insurance. I can go on vacation, car insurance, whatever it might be. That's a lot of money. Year 2 cost, you're still providing a huge economic value. Off that 809 network rate, again, year 2 on anniversary, 50%. So $405 is year 2 cost. However you look at it, the client is going to be talking about how much money they're saving. Whether that's tomorrow or a year down the road, that's a lot of money that they're saving by going with Ameritas Dental and Vision. So PrimeStar Vision, we're one of the only carriers that offers both EyeMed and VSP. Same thing I talked about with the dental. We want that member flexibility. We want them to be able to choose whether they want EyeMed or VSP. A lot of other carriers might just have EyeMed or might just have VSP. So they're really locked into either or. With us, they can pick. So with EyeMed, you're looking at like lens crafters, Pearl Vision, optical. It's a little bit lower plan, but with a lower cost plan, the eye exam is $25. Frame allowance and contact allowance is $130. Again, it's a little bit lower premium than a VSP, which I'll go over here in just a little bit, just over $10 with EyeMed. But look at the benefit frequency. So exam is once per year. Eyeglass lenses or contacts and frames is once every 2 years. Okay, so remember that. And now with VSP, you're looking at like Costco, Vision Works. They just added Walmart not too long ago. A little bit higher with the premium, but with eye exam is at $10 and frames and contact allowance is $150. So with EyeMed, it was $130. With VSP, it's $150. And then the price is just over $16. So EyeMed was just over $10. VSP is just over $16. So again, with the benefit frequencies, it's once per year on everything, on exams, eyeglass lenses or contacts, and frames. If you remember, EyeMed, eyeglass lenses or contacts and frames was once every 2 years. Really, when it comes down to vision, it's where they're used to going. If they've been going to EyeMed for a long time, then they're probably going to stick with EyeMed or VSP. And then really, how often do they need to go? How often do they need to get eyeglass lenses or contacts or frames? If it's once a year, VSP is probably the route to go. And really, it comes down to the price point as well. Just over $10 with EyeMed and just over $16 with VSP. So our last thing that I talked about at the beginning of this webinar is ease of enrollment. We want to make it as easy as possible to work together. And how we do that is through our enrollment process. So once you do get contracted with us, you'll get a personalized hyperlink. This is uniquely yours. This is how we track your business, how we track your commissions, how we track everything. And what's great about this hyperlink is you can put it on your website. You can send it via email because it's not a face-to-face sale. So it's a great resource to use and not have to have paper applications or even an e-app where the client has to go in and log in and do all that kind of stuff. This is just your personal hyperlink. The client doesn't have to log in to enroll. You don't have to log in to enroll. It's a very simple process. So again, if you're contracted with us, use your personal hyperlink. If you're not contracted with us, this is what you'll get, is your personalized hyperlink, and just make sure you use your hyperlink. Quoting is very easy. If you're looking to get a quote, it's very minimal info is required. Step 1 is zip code. Step 2 is plan coverage, insurance needs, and coverage start date. Again, you can coverage start date as soon as tomorrow. It's any coverage start date. It's the 1st through the 31st, but it's as soon as tomorrow. So once you get the quote, what you'll see is really 4 products that'll pop up. It'll be PrimeStar Protect Network first because it's lower premiums on the network products because we're knowing that client is going to be going in our network. And then the second one will be just PrimeStar Protect, and it'll be 4 because it'll be 1,000 or 2,000 on network, and then it'll be 1,000 or 2,000 on PrimeStar Protect. So again, with PrimeStar Protect Network, we're expecting that client to go in network. With PrimeStar Protect, they can go in or out of network, and that's why the premiums are a little bit higher. Find a provider. This is on your hyperlink that you get. If you're not quite contracted with us yet, you can go to star.ameritas.com/find-a-dentist, and you can look up a specific zip code, a county, a state, and you can see what providers are nearby. Also, the client can use your hyperlink or also go to that website to look up providers. So once you do type in either a county, a state, a zip code, all of our in-network providers will pop up. Question I always get is, what do the providers in green mean and what do the providers in black lettering mean? All the providers in green lettering or black lettering are in our network. The ones in green just have a higher than average discount. We want to say thank you to those providers for giving a higher than average negotiated rate for being in our network. But again, I'm not saying by any means the ones in black lettering do not have fantastic negotiated rates. They do. Again, we average about 34%, but we just want to say thank you to the ones in green that give a little bit higher than average. Once once you sign the client up, or if the client signs himself up, you'll get an email. The agent will receive an email, and then the policyholder will receive an email as well. This is very helpful because on that hyperlink, if you were to put it on your website, and maybe a client is just going to your website and enrolling themselves, you, the agent, will know every time someone does enroll. So it's a very easy process. Again, our enrollment process, you can do it under about 2 minutes. It's a very simple process, no signatures. It's all electronic, and it's all through that hyperlink. I just want to say thank you for joining me again. I appreciate you taking the time out of your day to learn more about Ameritas Dental. Look forward to working with you in the future, and have a great rest of your day.